Fellow Guyanese, I'm Dr. Shamdeo Prasad, Chief Medical Officer, and I wish to thank you for joining me for today's COVID-19 update. According to the World Health Organization, the global statistics are as follows. In the last 24 hours, the total number of cases have increased to 17,918,582, with 686,703 deaths. In the region of the Americas, the total number of cases is now 9,630,598, with 363,162 deaths. Now for the situational update in Guyana. As of August the 3rd, the total number of tests done is 6,236. The number of persons tested is 4,975, with 4,478 persons being negative. The number of positive cases is now 497, with 22 COVID-related deaths. The number of active cases in institutional isolation is 289. 38 persons are in institutional quarantine and 2 persons are in the COVID ICU. To date, 186 persons have recovered. The regional distribution of positive cases came from region number 7, 8 cases, region number 9, Arnaputa and Anai areas, region number 8, Canapan, 4 cases. Fellow Guyanese, I know that you have been following closely these daily briefs and that you are aware that our cases continue to climb, especially in the hotspot areas of regions 7 and 9. You would have heard that in the space of 96 hours, that's 4 days, we have reported 96 new cases, which is not a very bright picture. However, I wish to remind you that the coronavirus is not selective or exclusive. It's all around us, in and out of our country, Brazil, Venezuela, and Suriname. So everyone, everywhere, in all the 10 administrative regions, need to make this special effort to continue to play a part in spreading the message about COVID-19. There should be no letting up, complacency, and worse still, a laissez-faire attitude can be our undoing. Sadly, misconceptions about COVID-19 persist, including that the disease doesn't exist, that wearing a mask causes the disease, even testing brings about the disease. We need to dispel these myths if we are going to break the back of the camel, not only in regions 7 and 9, but in every community. This is the only way that we can support the selfless efforts of the health workers on the front line who are risking their lives to prevent the further transmission of the raging coronavirus disease. This brings me to the whole question of testing, which determines our positive and negative cases and put in train our surveillance team to track the contacts and identify additional sources. Bravo to the surveillance team and the lab staff working to provide us with timely results. However, on a more widespread level, I encourage all those experiencing symptoms to come forward and take advantage of our testing facilities. I wish to make a special plea to our younger persons not to delay but seek medical attention at the earliest. Fellow Guyanese, our irresponsible action impinges greatly on our health workers, whom we need to protect at all costs. They have families just like us. They want to enjoy life too. They deserve it, but they are making the sacrifice to protect all of us. So let us cooperate and comply with all the regulations of social distancing, hygiene etiquette, and wearing of the mask in public. Remember, the virus is highly contagious and you need to be extremely vigilant. We need a safe and healthy Guyana. I thank you.